I'm Molly Harbarger. I was a reporter at the Oregonian when the pandemic started. At the time, I covered homelessness for the past 4 or 5 years there. I'm now the editor of Project Homeless, which is a grant-funded team at the Seattle Times focused on homelessness and poverty issues. And I am joined by Anna Patrick, who will be helping me out with this presentation. She's the engagement editor at Project Homelessness.
All righty.
So,
yep.
Go for it.
Okay. So for our first question, I was hoping you could talk about, Molly, what it was like in Portland at the start of the coronavirus crisis, and what approach did the city take when it came to protecting its homeless population from this new virus?
Yeah, I had actually just returned from 2 weeks in Japan as coronavirus cases in Washington state began to increase in earnest. Shortly after that, it became more serious in Oregon as well. I had been asked to quarantine at home for a few days after returning from my trip. So I had only been in the office for about a week when Oregon's Governor Kate Brown shut down the state. At the time, she never said the word homeless. That week when the restrictions first went into place, or for several after, in Portland, it was clear that the pandemic planning for people in shelters was lagging behind that of housed people, and planning for people who were living outside was lagging even behind that. As I started reporting on it and inquired what would be done for hygiene, social distancing, those other kind of precautions, I remembered that I had visited Multnomah County, which is the county that Portland is in, their main headquarters shortly before I left for Japan for an interview. And as we walked into a conference room, we passed another room full of high-profile public health officials and elected officials and different kind of people, high-profile people with seats at the table. But the Joint Office of Homeless Services was not there. He was meeting with us, even though this was a coronavirus-related meeting. And I mentioned that to say that clearly people without housing, permanent housing, did not originally have a seat at this table. However, the Joint Office of Homeless Services, which is the kind of local authority that distributes funding from the city and county and sets homelessness policy with input from both of those bodies, pulled together a plan pretty quickly afterward. First, they sent social distancing guidelines to shelter operators. Then a week later announced that they would open hundreds of shelter beds to make social distancing easier. However, they didn't have the hundreds of beds secured yet. So the shelters opened over the next few days, and some for several weeks, in empty community centers, the Oregon Convention Center, hotels, that kind of place.
Alrighty. Yeah, now can we jump to going a little bit deeper into what was the shelter plan for Portland and what did it look like? How did it work?
Yeah, so they worked with what appeared to be very reluctant entities. The City Parks Bureau kind of reluctantly allowed empty community centers to be used. I heard from hotels near the Oregon Convention Center, including Metro, the body that owns the convention center itself, really wanting to restrict what photos were used and how the homeless shelter there was characterized, because it was clear that the Joint Office was having a hard time getting people on board, even in the midst of this global emergency, to allow homeless people to be in those spaces. However, they did get them open. And I got an insight into one of them. I was there for the creation of the convention center shelter to kind of observe how they were setting up the space to reduce transmission. I believe most of the shelters were similar in that they used curtains to separate cots and required people to sleep head to foot from cot to cot so that no one's head faced another person's. They removed chairs from eating and lounging spaces to reduce how many people could use that space at once and how many chairs were at each table. Of course, I don't know how strictly that was enforced once people were actually using those spaces. Most of these were operated under the same low barrier guidelines as pretty much all publicly funded shelters in Portland. And most of these shelters, actually all of these shelters, were just places to move people who were already in shelters. So these were not people they were taking from the street and putting into shelter. They were just moving them from one congregate shelter to these newer temporary spaces. So they were people who had already met those guidelines. In fact, it wasn't until the last few months in Portland that new shelter bed spaces were created, as in additional to what existed when the pandemic started. And that was largely because of the mayor's reelection campaign rather than concerns about people living outside during COVID. After opening a bunch of general shelters, the county then opened some motels for people who were unsheltered or in shelter who were either sick or at risk of being severely affected by COVID, people with respiratory issues or who were older, that kind of thing.
I just want to throw in one, this is an off the wall question, just to piggyback off of what you were talking about though, Molly, was the new measures that you saw being put into place, did it feel like it was an improvement to where folks were coming from? And did it feel like it was in the name of, like safety or just like, I'm just curious.
Yeah. In terms of safety, I think that what the Joint Office and the city and county were trying to do was in the name of safety and has largely been effective. We haven't really had large outbreaks in shelters. We have actually had very little transmission at all among homeless people. And I think that we now have some science that shows that putting people into motel rooms, hotel rooms at least, has been a positive for their ability to access services and move on to more permanent housing. However, at the beginning, we didn't know that, of course. However, it did raise this question of Oregon is behind in shelters throughout the state. And as in many places, when travel was restricted, motels, hotels were hard hit. And so it did really jumpstart this conversation about what we should be doing for homeless people in the first place. Should, if this was always an option, is a dollar spent on that hotel room better than a dollar spent on a congregate shelter?
Great. So now I want to talk about the strategies for addressing and helping and supporting people with behavioral health issues, or for folks who might not have as much access to traditional shelter for various reasons.
Yeah, people with severe addictions and mental illness were actually largely excluded from these shelters. I think that some officials would make the argument that because the shelters, the social distancing shelters, were essentially just moving people from congregate spaces into other spaces and not adding on, that the same rules apply. However, there was a lot of rhetoric about, especially around the for people with medical issues who are especially vulnerable. Someone with mental illness who maybe is going from the hospital, who would benefit from being in a shelter or even physically meet those qualifications, wouldn't necessarily be able to access that shelter because the severity of their mental illness would exclude them from that space. And that was never truly addressed. It was often said that, they were working on a solution for that, or they would try like hell not for that to not happen. It's a question of whether that was ever put to the test, but there were never spaces specifically for people who are struggling in the midst of an active addiction or mental health crisis to quarantine with services and supports. In fact, across the board, services for homeless people and, many people with addiction or mental illness was really narrowed. Oregon already is near the bottom of and in many metrics at the bottom for access for people with to access treatment to addiction, to access treatment to mental health services, and the restrictions of being able to not being able to see people or having those services kind of going into a social distance, work from home atmosphere really narrowed what is available. So on a good day, often being able to get behavioral health treatment requires that issue getting so bad that it requires hospitalization. And so when the main behavioral health hospital here restricted its intake, and then Providence and other hospitals that deal with both some inpatient but also outpatient services, when they had to limit interactions, it left a huge, huge gap that was largely unfilled. Portland has a few longstanding dry shelters or programs that require sobriety. Some are publicly funded, but most are operated by religious organizations and don't use public funding. Those remained unchanged for the most part, other than that they had the same issues with intake that almost all shelters dealt with. Leading up to the summer, the city opened 3 outdoor tent sites. Each of those have about 30 to 35 tents each, and were fenced in spots of city land that had pallets and tents and places to put your stuff and requirements for staying there, and then were governed by the people who live there. It was the first city-sanctioned format of doing those kind of tent communities. And they each had different priority populations. One was for people of color, one was for queer and trans people, and the third was more of a general population. Those were pushed for by some in the homeless advocacy community and some elected officials. However, there was quite a bit of pushback and criticism. The money could have been spent to expand hotel room capacity rather than having someone essentially remain unsheltered on the street. They could have been put in a hotel room. Or the groupings should have included a women's only site. In reality, the tent cities were hardly ever at capacity and appear to have a high rate of turnover. However, they maintain high support and now appear to be in the running for being expanded, especially as large encampments continue to grow around the city. However, that turnover, it's unclear whether people are leaving to go into permanent housing at high rates or if they're just being turned over.
I think that's a perfect transition to talk a little bit more about what the city of Portland did to support people who are unsheltered, people living outside throughout this crisis, and even still, right?
Yeah, as I mentioned, at the same time all of this was happening, the city ordered a stop to camp sweeps and camp cleanups per the CDC guidance that many cities have followed, at least on the West Coast. Portland's normal approach to cleanups and sweeps is a complaint-based system. So someone files a complaint or identifies a problem with a tent or an RV or a park, and then a person goes and takes that complaint, they go to that spot, and then they fill out a rubric based on what they see that kind of prioritizes urgency. And then if it threshold, that's that bar was essentially raised so high that I believe only one site had any workers at it before the county started opening up businesses again many months later. So there has been largely very little of that camp cleanup work that was very routine and was happening all over the city every day before. But once reopening started, that bar has been continuously lowered since then. And now we're at the point where there's talk about resuming those cleanups as normal before the pandemic happened. And part of that is because Portland, has often been criticized for allowing homeless people to camp pretty much anywhere. And so those encampments have grown bigger and bigger. And as people tend to not have to move, they stay put, and then they start communities. And people living there, according to my reporting, find that really useful because they can share resources at a time. There's fewer resources than ever. They don't have to keep moving around and worry about where they're going to sleep each night, or they can camp out near one of the few nonprofits that is open. But at the same time, it's caused a lot of anger and concern from the businesses and the housed residents that they're camping near. One of the kind of mitigating factors is that outreach work has also been reduced. For the first few weeks of the pandemic, teams of homeless people and low-income people who were organized by the street newspaper Street Roots canvassed homeless camps throughout the county to educate people about social distancing and best myths about coronavirus, and distribute hand sanitizer and like warm clothes and other kind of hygiene and the typical supplies. This was before masks were mandated, so they weren't giving out masks. But that effort was just kind of to get out the word to people who didn't necessarily have access to as much news. And then it was kind of cut off. The availability of free food was reduced to just a few places. And outreach workers who used to more actively distribute food to camps and people where they are switched to more of an open food pantry model so that they didn't have to expose their staff to as much risk, but it also relied on homeless people taking buses or other transportation to get there. Transit at the same time has been more fraught than usual for especially poor and homeless people, as bus drivers push for more and more strict safety requirements and also have more free rein to eject people they don't want riding. That can also disproportionately affect people who, appear to be in the midst of a mental health or substance use disorder issue. In terms of medical outreach, a volunteer group of doctors and nurses that formed before the pandemic has continued to do outreach. However, there are not formal mobile medical services other than existed prior to the pandemic. Portland still does not prioritize, they didn't before and they still don't prioritize offering COVID tests for homeless people or even people in shelter. You kind of have to, for a long time, you had to be sick or show symptoms, or you had to be able to get to a hospital or primary care provider. To my knowledge, outreach workers did not and still don't have access to testing kits. A few dozen mobile toilet and hand washing facilities were deployed at the beginning of the pandemic. In the last half of the year, that was increased to about 100. And that has largely been positive and made a big difference for a lot of people. However, there is still continuing issues with housed people who are near those toilets, wanting them to be moved or trying to close them or get rid of them. There are not publicly funded access to showers or other hygiene facilities, especially not indoors in Portland, and there never was, other than at established nonprofits. But a shower truck run by a nonprofit, Harbarger of Hope, is often stationed near where people can still get hot meals. And so that has been a very frequented and welcome asset. Nonprofits in general have struggled to keep up with services and maintaining the same level and also making sure there's access to them I wrote about domestic violence services, especially for people living outside, which have been reduced to the point of being almost non-existent if you don't already have a place to be inside. In a lot of places, as I mentioned, that have served hot meals have either closed, and so the ones that are still open have also had to pivot to providing clothes pantries and have water 24/7 when it was hot, and doing all these extra jobs because they're now the gathering place in a way that they didn't used to be. A day shelter might have been that place, but now everyone is on the sidewalk outside of Blanchet House. And then other places had to figure out how to find people in a safe way, which often means that unsheltered homeless people have just gotten lost in the system.
All right. Yeah, and so now, after talking about sort of these different aspects of the Portland's approach, I'm curious to get your thoughts on how you think homeless people in the city of Portland have fared under all of these strategies. Are they better or worse? Yeah.
Most of my reporting has showed that it wasn't really the disease that was hurting homeless people the most. Portland has had, as I mentioned, very low rates of transmission, both among unsheltered and sheltered people. I used Multnomah County's data tracking dashboard that's publicly available. And they disclose positive test results and rates among, they categorize it by both homeless people and non-homeless people, as well as racially, as well as like availability of other kind of services, PPE, that kind of thing. And according to those numbers, there is almost no transmission among people living outside, or wasn't for a very long time. And I think if we have had any outbreaks in shelters, they have been very small and very recent. However, when I interview people, the problems that they were facing before are more acute now. And I think that is the common thread that a lot of people find, is that COVID-19, if you have not personally gotten sick by it, exposes all the places that either your housing status or your race or your gender or anything about how you move through the world, how you earn money, that kind of thing. It exposes where those gaps are and where the services that existed before were falling short. And so for homeless people, I found it is the lack of services, at least in Portland, and places to go inside and rest and be out of the elements, especially now that we're running into, the pandemic started in the rainy season, and we're into that now when it's cold. We already occasionally have hypothermia deaths in the homeless population. And now there are very few places to get out of the elements ever. So that has been one of the biggest issues that I have found in terms of how this has affected the day-to-day life of people. Homeless people also were already in competition for resources, essentially. Portland and Multnomah County have invested more and more in homeless services each year, and yet the need seems to be the same or grow. And so now they are in even more competition for things like food and clothes with people who have lost their jobs or ran into new medical bills or whatever other effects the pandemic has caused, which is kind of a newer situation for a place that, we have more people on the brink of homelessness, but we also have a growing economy all the time, and that has largely stopped. Multnomah County, Portland, and the state of Oregon all have eviction moratoriums, and they now all line up to the same period. And they've all extended their moratoriums and it appears they will keep extending them. And they also created grace periods for repayment when the pandemic is over. However, there's no real plan in place for all the people who will never be able to make up a year's, maybe more, worth of lost rent once that moratorium is lifted. And the CARES Act funding, that the $1,200 that a lot of people got, if not more, in terms of unemployment, has missed a lot of poor and especially unsheltered people. You know, groups like Street Roots that I mentioned earlier, and some outreach workers tried pretty hard to sign up homeless people to get their $1,200. But even with that, I'm sure that tons of people didn't know or didn't have access to computers to sign up. And, you know, a lot of people are in this population are unable, at least in Portland. We have a growing senior citizen population on the street. We have growing numbers of people with disabilities. We have, you know, somewhere near 50% of people have behavioral health issues. And a lot of them, it can be, you know, debilitating to the point that they can't work. And so a lot of them were already outside of the job market. And so even with extra money added to unemployment checks, they weren't able to make the kind of cutoff to receive those unemployment checks in the first place. They didn't have jobs to lose. And if they did, they, you know, often didn't meet an income bar. So a lot of that federal funding that has maybe made marginal help for people at other income levels has been largely useless here. Local entities have, and the state of Oregon have provided no cash assistance to people on the street. And as far as I know, there is no plan to do that. So people are largely left with the few resources that are available at the time. There are some things that, you know, mitigate the cost of being homeless. Parking fines for RVs parked on the street have gone away. And it's hard to judge what the arrest rate is for homeless people right now. Prior to the pandemic, it was, as early as 2019, about 52% of all arrests in the city of Portland are of homeless people. The booking rate of homeless people has increased every year since 2017, when the Oregonian first analyzed that 52% was the rate of arrest. And so while that has held steady, booking rates have increased for homeless people. And so it's hard to say what has happened since the pandemic, especially because at the beginning, Portland police stopped going out to calls, or said that they did, unless it was like a life-threatening issue. And then the protests started, which, and then continued for the next, are still going on almost continuously. And so that kind of skews our statistics. A lot of the police in a protest, but there's also a lot more police presence. So it's hard to say what that end of finding and seeing homeless people looks like at this point. But we do know that the Multnomah County jails, the local jails, have reduced their population because of COVID, which likely will mean that people like who are picked up on criminal trespass 2 or lower level crimes are being released. And that might be a permanent change. Once the protest started, as I mentioned, a lot of the emphasis and attention and energy in the city shifted to that. It was such a big presence here, and we had the federal government come, and so our homelessness response largely was subsumed by what was going on in the street in a different capacity. It affected homeless people in some ways. You know, porta potties that were out in the protest zone were removed. You know, I reported on the protests, and there are many nights that I was running past people sleeping on the street who were on tear gas like the rest of us, or in the midst of flashbangs, and it was certainly disruptive. And there were also large groups of people who would be in those same spaces where people usually sleep, and there was always a risk that especially when we see those low rates of homelessness, of transmission among homeless people. It's a lot of public health officials attributed that to the fact that there wasn't much mixing between housed people who are maybe going to grocery stores, working at grocery stores, seeing people mixing with homeless people. And so there was concern that there would be kind of transmission that way, but we have not seen a lot of that so far.
I'm curious, after listening to you talk, Molly, is there something when it comes to addressing and serving people's needs who are homeless in Portland and what that will look like moving forward, right, in a post-COVID future? I'm just curious, is there anything that keeps you up at night or sort of like remaining questions that will, you know, take time to be determined of like how this will really impact folks?
Yeah, I mean, I think that I have a lot of concern that, you know, we talked about the eviction moratorium earlier, and that there's just not a lot of planning at this point for what that's going to look like. And I think it could be a pretty, you know, a lot of experts, even elected officials, have recognized that it's going to be a big blow. We spend a lot more money in Portland in the past few years on things like rapid rehousing, you know, trying to get people from the street into housing really quickly who seem like they would be able to sustain it once there. Culturally specific services, especially among the people who like qualify for rapid rehousing and those kind of services. And, you know, you can spend all of that money and it's still not going to keep up with the fact that so many more people are going to need it. And what are you going to do when, you know, you might have a lot of units come open, but even if people can move into those units that people are being evicted from, they're still not going to have the income to pay for it. And there just doesn't seem to be a lot of planning around that. So I think we're going to see a lot of conversation as people discuss what has worked well. Hotels, the state of Oregon is looking to buy a lot more motels and turn them into homeless shelter or permanent supportive housing. And those conversations are progressing locally and at a state level. And I think a lot of that conversation is already identified as like what we're going to take from the pandemic, but it's all the people who are going to newly enter homelessness and possibly stay there if there aren't good solutions for getting them out of it quickly. That I think is the big question that at least locally they haven't answered. Awesome. Thank you.